Welcome to The Explainer. I am absolutely pumped to have you joining us today because we're going to unpack a massive, fundamental shift happening right now in the healthcare industry. For the longest time, patient experience was treated like this kind of soft metric. It was something that was nice to have, maybe measured by a dusty suggestion box in the lobby or some delayed paper survey. But man, not anymore. Today, patient experience is an absolutely crucial, strategic driver for hospital growth, operational efficiency, and clinical excellence. And today, we're going to look at exactly how artificial intelligence is making that transformation a reality.
Okay, so here's our roadmap for today. We'll be looking at patient experience as business strategy, the cost of fragmented feedback, transforming engagement with AI, machine learning for proactive care, and finally, driving retention and future growth. Let's dive right in.
Section 1. Patient experience as business strategy. We are moving way beyond just clinical metrics.
There's this fantastic quote from recent research in the Journal of International Research for Engineering and Management. It states that patient experience is increasingly recognized as a critical indicator of healthcare quality, directly influencing things like accreditation, reimbursement, and public reporting. So what does this actually mean for us? It means every single patient interaction, literally from the second they try to schedule an appointment online, all the way to their post-discharge follow-up, is directly impacting your organization's bottom line and public reputation. It's the whole journey, not just the medical treatment itself.
And this ties perfectly into the very real impacts on hospital growth. Think about it. A seamless patient journey absolutely shapes trust and loyalty. And here's a clinical connection that's just a total game changer. Positive experiences actually improve patient adherence to their treatment plans. Basically, when patients feel truly heard, their health outcomes get better. On the business side, we all know retaining your existing patients is vastly more cost-effective than constantly bleeding marketing dollars to acquire new ones. Better perception boosts your digital ratings, which ultimately drives that long-term institutional resilience we're all looking for.
Section 2. The cost of fragmented feedback. We really need to talk about the huge liability of manual systems.
So I really want you to ask yourself this right now. Are your patient insights trapped in paper surveys? Seriously, think about your own facility. If valuable patient feedback is just sitting unread in a suggestion box or stuck in outdated electronic forms that your staff simply does not have the time to read, well, it's not just a missed opportunity, it's an active liability.
Let's compare this. Let's look at the dark ages of manual guesswork versus a modern data-driven action model. When you're relying on unstructured data and siloed paper forms, you are basically guaranteeing delayed responses. A patient could have an awful experience and you wouldn't find out for weeks. It forces administrators to rely on gut feelings. But when you flip that to a data-driven model, you get real-time analytics. Sentiments are categorized instantly, predictive alerts fire off right away, and your quality improvement becomes this continuous, evidence-based engine.
And let's not forget the massive human toll here. Trying to process manual feedback drastically increases the cognitive load and creates an incredible administrative bottleneck for your clinical staff. When your doctors, your nurses, and your front desk teams are bogged down doing manual data entry, their focus is literally being pulled away from high-value patient care. And frankly, that is just a lose-lose situation for everyone involved.
Section 3. Transforming engagement with AI. Let's look at how secure automation solves this problem.
80%. Let that number just sink in for a second. According to case study data from Makronova Tech systems, a real-world AI implementation achieved an 80% reduction in the time spent analyzing feedback compared to doing it manually. To put that into perspective, imagine giving your staff 80% of that administrative time right back. That isn't just some minor efficiency tweak. It is a total paradigm shift in how hospitals handle the voice of the patient.
So let's map out what this tech actually does for the outcomes you care about. First up, 24/7 chatbots. These handle instant appointment scheduling, which massively reduces staff cognitive load. Next, you have natural language processing, or NLP. This analyzes patient sentiment instantly, catching issues before they blow up, which correlates directly with lower complaint rates and actually helps prevent readmissions. And finally, automated dashboards give leadership real-time operational intelligence, replacing those stale paper reports with instant, actionable alerts.
And all of this pieces together to create what we call a patient experience pipeline. It's a clear 4-step journey. Step 1 is the 24/7 chatbot interacting via SMS or WhatsApp to instantly grab that feedback. Step 2, the NLP jumps in to process all that raw, unstructured data. Step 3, it turns that data into actionable analytics right on your dashboard. And Step 4, your team uses that clear data to drive immediate quality improvement. It turns raw chatter into a strategic asset in seconds. Now, I hear this concern all the time. People worry, hey, isn't AI going to remove the human element from healthcare? Actually, scratch that. It does the exact opposite. AI chatbots take over the mind-numbing routine tasks, the FAQs, the reminders, the scheduling, which literally frees up your human staff to provide deeper, much more empathetic care to the patient who is standing right in front of them. AI doesn't replace the human touch, you guys. It protects it.
Section 4. Machine Learning for Proactive Care. This is where we go from reacting to anticipating.
Okay, I'm going to get just a tiny bit technical for a second, but stay with me because the operational benefits are huge. It's called topic modeling. Basically, it's an AI algorithm that clusters related terms across thousands of pieces of feedback. It's like having the AI assemble a giant puzzle for you to uncover hidden themes. It can literally spot invisible operational leaks, like say a sudden spike in complaints about discharge delays in one specific ward, way before they turn into major liabilities.
The biggest takeaway here is that machine learning shifts your hospital from reactive apologies to proactive interventions. In one published case study, AI analyzing patient feedback actually spotted a recurring theme of medication errors. That insight allowed the hospital to jump in and upgrade their safety protocols immediately, drastically reducing adverse events. I mean, that is technology directly saving lives.
But look, we have to be real. Absolutely none of this matters if your data isn't secure. In healthcare, patient trust is everything. Your digital transformation has to be built on an ironclad foundation of compliance. Enterprise AI systems use strict anonymization to protect privacy, and they align with all the big ones: ODPC, GDPR, HIPAA, and SOC 2. Plus, they require continuous auditing to mitigate bias, ensuring fair care across all demographics. You just can't cut corners on trust.
Section 5. Driving Retention and Future Growth. Let's look at the next era of healthcare.
The innovations coming down the pipeline are just incredible. We are rapidly moving toward a multimodal future. Soon, emerging AI won't just be reading text. It's going to combine text, voice, and even video to pick up on tone and body language. It's projected to capture up to 4 times more context per interaction. That means a vastly richer, more empathetic understanding of exactly what your patients are going through.
So let's do a quick executive recap of these strategic benefits. By treating patient experience as a true business asset and integrating AI, you lock in cost-effective patient retention. You build profound trust, which gets your patients to actually comply with their clinical plans. You eliminate all that frustrating, manual operational guesswork. And the result? You generate higher ratings and 5-star digital reviews that absolutely fuel your future growth.
I'll leave you with this final thought. In today's digital-first healthcare landscape, can your organization really afford to leave the patient experience to chance? Relying on those old manual processes doesn't just waste time, it bleeds patient trust, hurts clinical outcomes, and stalls your growth. Embracing intelligent automation isn't just a nice operational upgrade anymore, it's the necessary path forward. Thank you so much for joining me for this explainer, and I really hope this gave you a clear, actionable framework for how AI is reshaping the future of care.